Good morning, everyone. I'm Karl Bertrand. Good morning. Okay, can I have your attention, please? May the class come to order, please. Thank you. So I'm Karl Bertrand, and we're here to learn how to use data to change the world, basically, to mobilize communities and to change lives. And I'm going to do the first half of the two-part presentation, and my part's focused on really how to shape the data and point it so that it creates change quickly. Now, in the last 30 years, I have started several not-for-profits, about a half dozen coalitions, written 2,000 grants, raised $300 million, and started several hundred different interagency collaborations. So that basically the core of my job is persuading groups of people to very quickly commit to a common cause and to commit their resources to do that. So the next 25 minutes or so, I'm going to condense everything I've learned in 30 years into 6 easy rules that you can use to take your data and use it to bring action. The first rule, if you don't remember anything else from my whole presentation, the most important one is this one sentence. The more you say, the less to do. The problem is that people who are good with data love data, and when you give people lots of data, none of it sticks. None of it leads to action. So the longer your document, the less likely it is to be read. If you send me 100 pages, if it sounds interesting, maybe I'll file it. If you send me 10 pages, maybe I'll skim it. Send me 1 page, I'll probably skim every paragraph. And if you send me an email that says, we serve 52 of the most medically vulnerable homeless and found housing for 66% last year, I'll actually remember everything you wanted me to know.
Do you want to just let people know that you'll get the PowerPoint out afterwards?
Yes, I will distribute my PowerPoint afterwards. I don't want you reading ahead.
I thought everybody was like that, and I was like, that, you gotta let it know.
No, you'll get all the slides. Just don't want you to read ahead. And most people who read long documents actually just skim them. And the most senior people, like mayors and superintendents and CEOs, seldom read more than a page because there's so much paper flowing across. It's just, who can I give this to? Which can I throw away? Okay, there's a few left that I have to deal with. So you need to start with what's called an elevator speech. So an elevator speech is, my theory is that any great idea can be summarized in about 4 sentences. So here's an example. Early 1980s, Westchester has a huge homeless problem. Property taxes are skyrocketing. I ride down the elevator from the 8th floor to the 1st floor with a wealthy financier who's concerned about property taxes. And the elevator speech was, I think, we're spending $50 million a year on homelessness. We're spending $60,000 for each homeless family, housing them in motels all over the 7-county region, and paying hundreds of dollars each day to bring kids back and forth from the Dutchess County motel to their Mount Vernon school. We're spending $60,000 when we could prevent it for a few hundred or a few thousand. Government funding is too restrictive. If we just had some private flexible funding, we could help people and save tons of money. And he said, will you have breakfast with me? There was Oscar Pollock, and that was the start of the Bridge Fund, the largest privately funded homelessness prevention program in Westchester. Another one was, we run the biggest emergency food program in Westchester. We can't afford to buy fruit and fresh fruit and produce. If you made a one-time capital investment of $24,000, we could buy a van and get 4 tons of fresh produce donated every year from Hunts Point. That was the start that turned into the Food Bank of Westchester. So, example A, sometimes you use it in grants, sometimes you use it in charts. First is about using it in grant applications, because that's one of the things I do. So one of the problems is, so you have 4 sentences going to sell your project. But now you have to write 20, 30, 50, 80 pages, and it gets buried in all there. And sometimes they don't let you do a summary, they just say, here are the different parts. So I give them the elevator speech up front, whether they ask for it or not, just say overview. And because you can convince people in that first paragraph. And if you haven't convinced them in that first paragraph, and they've got 50 of these to read, yours is likely to wind up on the floor. So repeat key points in various sections. Like for instance, here was another one. Yonkers has the largest Hispanic community in New York State outside New York City. No one is currently offering culturally tailored, evidence-based parenting education. We're a minority-controlled we're a minority-controlled organization. We've got something that's been proven with effective families. We're prepared to start offering this model culturally tailored to Hispanics, offer it in Spanish, in the middle of the Spanish community. Can you give us some money? And so the needs section was, oh, did I mention that we're the largest Hispanic community, underlined, largest polls, that we're a minority controlled, that 40% of the people we serve are Hispanic, so that each thing was all sort of reinforcing the elevator speech. The other thing is to emphasize key points with bullets, underlining, and bold type, because if you just hand pages of text, it just gets lost. It just turns into a blur. And particularly if you have your 30 pages, but maybe they've read 3,000 pages of these and they need to get home to pick up their child from childcare. So if it doesn't reach out and grab them, it just gets lost. So here's an example. This is West End. We've rehoused 6,000 homeless families. We've built or renovated 2,500 homeless units, after school for 2,000 youth, and jobs for 500 each year. From the bullets, you see they do a lot of things. From the underline, you see they're important things. From the big, bold-faced numbers, you see they do a lot of them. So what you remember from that page is they do a lot of important things and they achieve a lot of outcomes in each one of the areas. Okay, mission accomplished for that page. Now, the second example is using charts to drive action. Now, Mount Vernon this year decided we're going to try to reduce suspensions. And the school's going to work with the community and let's focus on this problem. And so for the first big meeting, they handed me 41 pages of data about every suspension for every student in every school. What can I possibly do with 41 pages? If I gave it to every one of you, we would accomplish nothing in the next hour. So after a month, I boiled all that down to one big legal-sized chart. And what this has is all the elementary schools, and then the middle schools, and the high school students, and it shows how many kids in each school have been suspended for a total of 1 day, 2 days, 3 days, 4 days. For example, elementary school number 1 has 10 people who've been suspended for a total of 10 days, 6 for 2 days, etc. The problem is, I was really proud that I condensed it to this, but this is still too busy to really bring your attention to what's important. By the second month, I wanted people to focus on the schools that had the most kids who were being suspended the most. And what you see is I've got schools with no suspensions, that's just clutter. And I show you 12 days, 13, and 14 days separately, that's just clutter, because that doesn't change, what you're going to deal with. So what I'm changing it to for this month is that. Now I'm saying the thing we need to focus on suspensions are the kids who are impacted most, because they're suspended the most days. We can't do everything at once. Let's find an elementary school to focus on. And if you look at kids who've been suspended 6 or more days, there are 10 and 9 of them are in one school. I suggest that we agree to focus on that school. Everybody in favor? Okay, moving on. Middle schools. If you look at 6 or more, there are 8 of them. They're all in one middle school. May I suggest we focus on that middle school? Okay, consensus on that. Moving on. High schools. If you look at 11 or more days, there are 7 of them, 6 are at one school. If you look at the 6 to 10, there are 22 of them and 12 of them are at that same school. May I suggest that we focus on that high school? So we are now focusing on that elementary, that middle, and that high school. We got consensus in the room with like 50 people with the cluttered chart. This one really makes the angels sing. This one could get groups to reach consensus within seconds or minutes, and that's really what you want to be able to do. Here's another example. I've been working with Rochester for several years to reduce chronic absenteeism. The head of the United Way called in 24 CEOs to talk about the problem. And he showed them a chart I had produced like this. And what chronically absent is missing 10% or more of the school year, and that's been shown to change the whole trajectory of their lives and academic performance. And if you look, in Rochester, the biggest group that's affected are African Americans. And then which group's got the highest rate? It's Hispanics with 39.8%, and many of those are immigrants and English language learners. So the kids who need the most help learning to read in English aren't coming to school to learn those skills. So if you care about African Americans, or if you care about Hispanics, you need to help us address this problem. So he presented this, and he said this chart was really the turning point. 24 CEOs went, I will give you priority access to my services for the kids you target as highest need in one meeting. And so this is the kind of chart that drives action. Now another thing, rule number 2, is you need to express the problem in dramatic human terms. You need to communicate the urgency. For example, there is a vulnerability index, and it looks at how medically vulnerable you are. And it's, are you over 65? Have you ever had frostbite? Do you sleep outside? Have you had a heart attack? Do you have cancer? Things like that. And I could say we have a list of the medically vulnerable homeless, and no one would do anything. Instead, what I say is, I have a prioritized list of 800 homeless people in Westchester, and I can identify right now the 10 people most likely to die in the next 12 months if we don't get them housing. Will you help us? The answer is yes. One way you phrase it, it's boring, you get lost in the noise. The other way, people go, wow, yes, the answer is yes. Another is chronically absent. The way I describe it now is it's bending the whole life trajectory of these kids towards school dropout, poverty, and crime. Most suspended, we're adding up now the number of kids who've been suspended most in the city of Mount Vernon, and that's basically the highest need kids in the city of Mount Vernon. Are you willing to help the highest need kids in the city of Mount Vernon? The answer has been yes. For elementary school, if you're being suspended 6, 9, 10 days by elementary school, you're already being sucked into the pipeline to prison, and you're only in 2nd grade. We need to act. Most suspended in high school. Both legs are already in the pipeline to prison. We've got to drop what we're doing. We've got to run over and grab them by the shoulders and yank them out and give them another chance at a decent life. And there's no time to waste because that close to being in prison. You also need to use data to appeal to multiple constituencies, because there's lots of problems that everybody sort of, it's like a room full of kittens all going in different directions, and you need to try to get them all to be working toward a common cause. So I made a PowerPoint, Why Truancy Matters, how chronic truancy hurts individuals and communities, and I used data. And I showed the chronic truancy is linked to educational failure and increased juvenile crime and other risky teen behaviors and child abuse and increased adult crime and long-term poverty. So then I ended with a slide that said, here's the bottom line. If you care about helping at-risk kids, or reducing crime, or making sure schools are successful, or protecting kids from child abuse, or alleviating poverty, or trying to strengthen our community and be able to bring business and economic development, we share a common stake in addressing chronic absenteeism. So in Rochester, I had one PowerPoint to persuade the mayor, community leaders, the school district, all the administration, and a bunch of other people, are you willing to work on this program? And at the end of the PowerPoint, they all said yes. Then you need to, the problem today is that there's not enough money to go around and everything's getting cut, and it's just like, it feels like such a world of scarcity, and yet you need to try to get the resources for the people who need it most. Data can make that happen. For example, the one about the medically vulnerable. So I had a list. Here are the 10 people most likely to die if we don't get them housing. You've got the major source of housing for the county. You have a long waiting list. Can you make any room on your waiting list for the top 10? And they go, oh, we really, there's so many people who need that. I go, yeah, but they're waiting in apartments. This guy's like sleeping under the stairs in a parking garage. Can you make room for 5 people on your waiting list? How about 2? How about 1? So far, no one has said, I can't do anything to help the people most likely to die in the next 12 months. In fact, I was doing a presentation to 3 counties in Pennsylvania to try to start, and then they broke out, what can you do? And this woman said, we can't do anything. And then she came back in and said, I called my boss, okay, we can do housing for 10 veterans, because Mr. Bertrand was looking at me. But it's really hard to just say you won't do anything when it's presented like that. The other is, in Mount Vernon, we just pulled together a group and said, we've identified the 10 kids who are suspended most. Will you help us come up with some sort of solution for them? And the answer was, we're all really busy. But yes, there's a cross-systems unit for the county where probation and DSS and mental health do case planning. It's really hard to get into that. So I called them and said, okay, Mount Vernon has its top 10 highest need kids. Can you make room in this year to see those top 10? The answer is yes. And it's data that's going to kick open that door and give them priority access to all those resources. You also need to overcome scarce resources by refocusing what there does exist. For instance, 2007, I organized a group to address truancy in Yonkers. The problem was there were 2,000 kids who missed 30 days or more of school, and the last truancy grant had ended. 2,000 kids, $0. We could just end in despair. Instead, what I said, I had the school superintendent, the police commissioner, the head of CPS, the family court, and some other agencies, and I said, look, we all agree this is a huge problem, and we can't solve it. We don't have the resources. But the people at this table have thousands of staff. The people at this table have millions of dollars. Now, do you think we can do anything smarter with what we've got? Because if you do, come join this work group and let's figure out what it is. And if you think we're doing everything right, there's nothing else to do, then get up and walk away, because this is just going to be a waste of your time. Everybody stayed. What it turned out is there was an educational neglect process that was there, and it's in the law, but it was hardly being used. 2,000 chronic truants, I don't know, maybe 50 reports filed. And then if the schools file the reports, then CPS has to investigate, and family court has to deal, and resources have to get available, and probation has to get involved, and all these creaky wheels of government start all in the same direction. And there was no new money, it was just making what was there all align. Another example, at Mount Vernon, from 2009 to 2011, we cut total absenteeism, not just unexcused, total absenteeism in the whole district by 19.8% in 2 years, with not a zero new dollar in one of the poorest districts in the county. Some of it was better reporting, some of it was changing community attitudes, and some of it was case level changes in the way services dealt with families. Rule number 6, the final one, use the scarcity. The very fact there's not enough money to go around is why we need to work in different ways. So, I blew the punchline. So, I've raised $300 million. I'm good at spotting where the money is going, and if you ask me today, where is the money going? Because it seems to be drying up everywhere I look. The answer is programs that can do more with less. Every level of government, basically, if you go and say, I can achieve more outcomes with less money, the door swings open and the money flows in your direction. So in Yonkers, they hired me to put together a big community planning process, 2 years, 80 people, figure out how to prevent juvenile crime. And the state had identified like 54 risk factors. Being male is a risk factor. Being black's a risk factor. Being poor, being in a gang, having a gang kill your brother last week. It's always just like check marks in a box. And what was astonishing is no one in America had weighed the relative significance of different risk factors. We helped the Yonkers police rescue 26 years of juvenile crime data and move it into Access. And then we were able to use the kind of, to export it, strip away all the identifying information, and just have a unique ID that was used to encode HIV records. And we did the same with school suspension and attendance and special ed and foster care and poverty and gender and age. And for the first time in the history of America, we were able to measure the actual impact of different risk factors and combinations of risk factors on 1, 2, and 3 year arrest rates. And we came up with the pyramid of risk. Now at the bottom is Yonkers had 26,000 kids. We don't have enough money to help 26,000 kids, but only 3% of them would get arrested the next 3 years. What about males? Well, it's 13,000 and only 5% of those would get arrested. Now traditionally what we do is we focus on serving the right age kids in the poorest neighborhoods. And as one Yonkers CEO goes, all my kids are high risk. Well, the data showed that only 7% of the kids in that neighborhood actually got arrested. So if you were going to get if you were going to focus juvenile crime prevention on that neighborhood, 93% of all the kids you served would not be part of the problem you were trying to solve. And that's if you get a random sample, but you don't get a random sample. You get the kids who volunteer, and the parents sign consent, so they don't come drunk and they don't fight. So that's why you can have agencies who are using evidence-based programs, randomly applied, and they have all the money that's available and the best people, and they're pouring their heart out, and it's still African-American blood on the sidewalk because they're never reaching the kids who need it most. But now step up the chart. If you look at kids 7 to 8 with 20 or more absences, there are only 709 in the whole city, and 21% arrest rate. So if you serve chronic absent middle school students, you can be 3 times as effective with the same amount of money. Or the next tier up, someone who's had a 3-day suspension, there are only 230 and 24% of them get arrested. So if you want to target prevention resources, suspensions were the way to go. But go up higher, then it's, if you've been arrested by the age of 13, there's a 41% recidivism. But the astonishing thing is we found this group, it was grades 6 to 8, 20 more absences, and 1 3-day suspension. There were only 41 in the whole city of Yonkers, and they had a 61% arrest rate. It was 25 kids who got arrested. And those 25 kids, within a 5-year period, had 127 juvenile arrests or serious and violent school incidents, and that's before they hit the big time and started getting treated as adults by the criminal justice system. So I've lectured all over for the Department of Justice and DCJS and NASW. And the point I make is funds have been cut. We can't afford to do business as usual anymore. And cities can't do all the things they wish they could do. But there's no city in America so poor that it can't serve those 41 kids. We can give them everything they need because we can tell if you're going to be spending limited funds, that's how you spend it best. So, that's the end of my part. We can have questions now, or we can jump into, yes, ma'am.
Well, do you want me to save it till after Sarah?
No, I'm fine with folks doing some Q&A.
Yeah.
I'm curious because the data is 2003, and what are the changes now?
We don't know. It's really a unique data set, and we've gotten parts of it updated, but not other parts, and we need to have it all in order to update it.
In other words, you can't look at that 61% from 2003 and see what's happened to it.
No, because it's de-identified. The only way we could get all that confidential data was to de-identify it. So we have unique IDs and no way to reach those actual people.
But you did provide services to those.
What we showed was this is the group. That basically the schools list of people who are chronically absent, the schools list of people who are frequently suspended, those are the two lists of the highest risk student kids, and then we got community agencies to target their resources to that group.
And they did?
Yes.
Oh, okay, I'm just
Like
saying
Big
it
Brothers
wasn't...
Big Sisters got mentoring slots, and you
Okay.
had to be chronically absent or suspended or have a parent in prison. And they found it was really hard to get chronically absent kids to show up and to get their parents to cooperate. And I said, you can't have the money though unless you do that. And they found ways to engage them.
Yeah, see,
So-
I think that's the other interesting piece is what that, you didn't talk about, is that people did step forward to help those, whether the...
What data really drove it, it was such a clear need, then it was getting people to figure out how. I actually have a list of 10 things agencies can do to make their services most available to the families that need it most. So once they're willing to work, then there are ways to help them focus more effectively. But the main thing is that schools have the list of the kids that everyone who's concerned about kids need. They all need to line up to help the kids that you identify, particularly those you're suspending the most.
Thank you.
Yes, ma'am.
So if I were a CEO, CFO, and I wanted to put money in, and I were looking at this, love the data, love everything else, but there's no results that are there, because that's the bottom line they're going to be asking about. Are there significant studies of this nature that have the results, so that I don't feel that I may have put all the money toward the people, and I want to be caring and helpful, but then the money didn't make a difference in the meantime? So do I then go to tier 2 or tier 3 down the line, as opposed to the tier 1?
We have evidence-based programs that are proven effective that often aren't used.
Mhm.
Money goes to things we've made up by the seat of our pants rather than those. But when we have those, they tend to be randomly applied with neighborhood-based targeting. So what we did once we identified the highest risk kids is said, now we want evidence-based services. Big Brothers Big Sisters mentoring, best mentoring program in the country, proven for 60 years. What's it called? There was a parenting education program that the federal government showed was one of the most effective, and I'm drawing a blank because I haven't slept for 3 nights hardly. I'm sorry.
Just because of this presentation?
No, I have all these grants due today.
Is it parenting with love and limits?
No, but there's actually a national registry of effective programs and practices that lists strengthening families. Thank you.
Yeah.
I brought the head
In the
of
CTC framework, and it's a very targeted intervention.
I brought the head of Center for Substance Abuse Treatment, who had invented it and measured it and documented it, to Yonkers and explained, here's this wonderful thing that in 6 weeks can change long-term trajectories for kids and families. Please learn how to do that. Yes, ma'am.
Hi, how are you? I'm the Yonkers Council PTA's president. We have 38 PTA units in Yonkers, and what we're experiencing is lack of parental engagement or involvement with advocacy. For example, you mentioned that there's lack of resources, lack of state funding, or just in general educational funding. How does a parent group, or for the purpose of engaging parents, can data be used, and how, I think it's important how it's presented to the parents? You did mention that, having bullets, underlining, bolding, and having one page is the easiest thing to do, but what other uses of technology, what other ideas would you suggest to just keep people informed, and then once people are informed, hopefully they'll be motivated enough, or at least able to engage their board of ed or the trustees or the city or the state.
What we did was we worked with community agencies that already had the families we needed. So we used data to give them priority. We made evidence-based programs available, but we trained community-based organizations that already had hundreds of the high-risk families coming there so that they can now offer the right things. So we trained 6 agencies, and it was the Yonkers Community Action Program and the YMCA and all these well-trusted community groups. YMCA was brilliant. They wanted you to do strengthening families. It's like 10 different groups. It's a lot of time to commit. They offered a free pool membership for the entire family if your group came. Their groups were so full. It was just brilliant. Yeah.
So, there's this struggle right now in government funding. Like, you have there's a new drug-free communities grant in Yonkers, and they applied like 4 times before they finally got it. I'm in year 10 in my community in Ossining. So that funding stream forces you to do strictly environmental strategies, right? The bottom tier 1. Yet your data shows the compelling need for tier 3 interventions, which are strengthening families is a very expensive program. So how do we do that? Do we have to go to the private sector? Like, it's so hard to get funding. You need to do both environmental and targeted tier 1 at the same time.
We trained agencies to do strengthening families, gave them money for meals and babysitting and a little bit of staff time for 3 years with the deal that they would then continue. And all they had to find money was babysitters and meals, because their own staff
So
were
who
now
was the
trained.
we that funded that?
DCJ, I got a Department of Criminal Justice Services grant for the Yonkers Police Department that we used to train 6 agencies in the model to serve the right kids. But anyway, I'm going to cut the question short because standing next to me, New York City did one of the biggest attendance improvement programs in the country. 100 schools, 60,000 students, 3 years, rigorously evaluated by Johns Hopkins. And what they found is out of everything New York City tried, there was one part that worked better than anything else. And what was something called success mentors. And the woman who trained 10,000 success mentors for 10,000 students as part of a pilot in New York City, because in New York City, serving 10,000 students is just a pilot, is right here. And she came to Rochester and taught them how to do it. She works 40 miles from here. She does national training. Will you people please start implementing her program?